Hi, everybody. My name is Sharon, and today I will be talking about hospital determinants of patient satisfaction in rural versus non-rural zip codes in the United States. To start, what is patient satisfaction? Well, presently, there isn't a universal agreement on how to define the concept or measure of patient satisfaction in healthcare. Patient satisfaction has been referred to as patient's attitude or as the alignment between patients' expectations of ideal care and their perceptions of the care they actually received. The lack of a common definition is most likely due to the various overlapping terms like satisfaction, engagement, perceptions, and preferences, which can pose challenges when we're trying to measure these concepts. Regardless, there's a really strong agreement on using patient satisfaction as a quality indicator. Assessing patient satisfaction helps us identify areas for improvement in healthcare services, such as research utilization or communication between healthcare providers and patients. This approach is a realistic, cost and time effective way to evaluate quality of care. Also, it is crucial to align healthcare services with our patients' expectations. Multiple previous studies found that patients who experience satisfaction were more likely to follow their physician's advice and exhibit stronger loyalty to their healthcare providers. The Hospital Consumer Assessment of Healthcare Providers and Systems, aka HCAHPS, patient survey was established in 2002 as the first standardized national survey to publicly report patient perspectives on hospital care. This allowed for comparisons among hospitals at local, regional, and national levels. Most hospitals in the US are required to submit their survey results to the Centers for Medicare and Medicaid Services for their financial reimbursement. However, there remains a lack of published literature that compares studies using consistent survey methods to report on determinants of patient satisfaction within the United States. So, two researchers named Liz and Badabar, they emphasized the importance of comparing studies that use consistent survey questions and response options with exact wording to ensure comparability across studies. And as patient satisfaction continues to evolve, ongoing monitoring of the determinants related to current patient satisfaction is also essential. As you can see here, I have highlighted in red. I want to just really again emphasize the importance of using standardized survey methods so we can have comparability to eventually reach a definitive conclusion. Also, it is essential to examine geographical disparities in patient satisfaction, taking into account where our patients access their care. Conducting geographical comparisons provide insight into how geographic factors like rural status contribute to variations in healthcare quality across the United States. This emphasis on geographical disparities is important because multiple studies found that individuals living in rural areas face disproportionately poor health outcomes compared to those living in urban areas in the United States. So, if we're looking at the figure on the right, we can see that residents of rural areas have higher rates of heart disease and cancer. And then looking at the figure on the left, they also have a higher mortality rate than those of urban areas. Despite all of this, there's still a notable lack of research that examines rural urban distinctions in patient satisfaction. Therefore, the purpose of our study is to look at hospital determinants of patient satisfaction using these HCAP survey results, which in turn can reflect the quality of care provided by hospitals in the United States. Also, we wanted to see whether rural status influences patient satisfaction ratings. We accessed two public data sets of the survey results collected from July 1st, 2021 to June 30th, 2022. These were already adjusted for comparability and published by Centers for Medicare and Medicaid Services. A total of 4,714 hospitals contributed their survey results to this dataset. Rural status of each hospital was determined by matching zip codes with data provided by Health Resources and Services Administration. The HCAP survey comprises a total of 29 questions that ask discharged patient about their recent hospital stay. 19 questions specifically cover the essential aspects of the hospital experiences, which are variables, such as communication of health providers, responsiveness of the hospital staff, the cleanliness, the quietness of the hospital, and overall hospital rating they would give. The survey responses to these 19 substantive questions were converted into linear mean scores, which are then used to compute a star rating for each hospital determinant. The linear mean score ranged from 0 to 100, while the star rating ranged from 1 to 5, with 1 being the worst rating and 5 being the best rating. A higher linear mean score, thus higher star rating, indicated better patient experiences and satisfaction. A total of 3,213 hospitals were included in this analysis, with approximately 51.14% located in rural areas. We used RStudio to perform descriptive statistics of the linear mean score of each hospital determinant, as you can see here in the table. An independent sample t-test was performed to compare linear mean score of each hospital determinant, stratifying by rurality. Prior studies conducted over the last decade found that nurse and communication had the most impact on overall patient satisfaction. The first finding of our study aligned with this trend, given that those two hospital determinants had the highest average linear mean score, thus ratings. This observation is in line with the ongoing efforts to improve communication within healthcare settings. There has been a growing emphasis on integrating communication training into healthcare provider curriculum. This is mainly driven by studies that demonstrated improved patient satisfaction following such training compared to the control group without training. Communication about medicine displayed the lowest linear mean score, which suggests an area for future improvement and future emphasis in training. Additionally, there was a significant difference across every hospital determinant when comparing rural and non-rural status. So referring to the table here, rural hospitals had a higher average linear mean score for every hospital determinant. This finding challenges prior research that typically associated rural hospitals with lower levels of satisfaction. So, for example, a previous study that used HCAP data from 2007 found that rural hospital patients are less likely to report cleanliness in their environment, suggesting potential issues related to system management and availability of cleaning staff in rural hospitals. The higher average linear mean scores in our study may indicate that there has been improvement in these aspects in more recent years. However, another study did suggest that patients in rural area had higher patient satisfaction than in urban area due to lower expectations stemming from the limited availability of medical resources in rural settings. In conclusion, rural hospitals having better HCAP performance due to either improved quality or due to rural patients having lower expectations are both plausible reasons for the results. However, future research is needed to investigate the reason for rural hospitals performing better on HCAP surveys and if this outcome is consistent. Furthermore, future studies should also specifically use HCAP surveys because, again, most hospitals are required to publicly report their HCAP results, and it allows for comparability. This all can provide more insight into how patient satisfaction is influenced by these geographical disparities and if the other hospital determinants are improving in a timely manner, helping policymakers and healthcare providers better tailor their services to meet the unique needs of all these different populations in the United States. I just wanted to end off by saying thank you so much to Dr. Hung for guiding me through this project and Logan and Neha for their feedback and input.